Guys, it is getting to that time of year where the weather is warming up and the sweat is starting to flow. Now, sweating is a normal bodily function. We need it to help with thermal regulation, to help us cool down in these hot climates. But some people suffer from excessive sweating known as hyperhidrosis, and in this video, I'm going to tell you about the treatment options available for this condition. My name is Usama, aka Real Skin Doctor, and I am a dermatologist living and working in New York. On this channel, I give evidence-based skincare advice, and I also talk through some common dermatology conditions. So if you're interested in either of those things, make sure you subscribe to the channel. So first things first, what counts as excessive sweating? So there's actually a type of diagnostic test for excessive sweating, which doctors actually used to do a few decades ago, where they would bring a patient into the room and paint them with this starch solution that looked kind of brown, and they would then track to see the amount of sweat that came down and measure it and then reach a diagnosis of hyperhidrosis. Thankfully, that test has fallen out of favor over time, which I'm grateful for because I can't imagine the kind of Google reviews I would have gotten if I had painted my patients in starch. And now we diagnose hyperhidrosis based on clinical symptoms and the patient reporting that the excessive sweating is affecting their day-to-day life. So what are the treatment options out there? Well, step one is almost always a clinical strength anti-perspirant deodorant. And what I mean by that is one that has a high percentage of aluminium chloride, usually something like 12%. So that doesn't mean these natural aluminium free ones that you see right now. It means one like Certain Dry that I have here, which has 12% aluminium chloride in it. And so yeah, you simply shake it up and roll it on as you would any other anti-perspirant deodorant. Okay, so I'm going to roll it onto this sweaty forearm of mine right now. Now, the thing a lot of people get wrong is that you're actually supposed to apply your anti-perspirant deodorant the night before when you're going to sleep. That gives the aluminium chloride enough time to react with the sweat that's coming out of the sweat glands and to form the crystals that actually block these ducts and stop you from sweating. Often people wake up in the morning, jump out of the shower, put on their deodorant and then head out, and then they feel like the deodorant is not working because they're still sweating. But that might be because you haven't given it enough time to have its effect and to make these crystals. So yeah, products like Certain Dry are a great option, but the downsides of these are that high percentage aluminium chloride substances can actually be really irritating. I get tons of patients coming in with armpit rashes because they're using products like these. So what other options are out there? There's actually a tablet medication called Glycopyrolate that you can take once a day, and it helps reduce the amount that you sweat. As I always say, this is not medical advice and you're going to have to discuss these options with your dermatologist, but Glycopyrolate can be very effective for a lot of people. The great thing about Glycopyrolate is that it's a tablet and therefore it travels everywhere, and so it can reduce sweating on a lot of different parts of your skin at the same time. The downside of Glycopyrolate is that it's a tablet which travels everywhere, and therefore there can be side effects on other parts of the body, including things like a dry mouth and blurry vision. Although these side effects are rare, it puts a lot of people off, and so some people don't want to do Glycopyrolate as a tablet. Now that takes us on to treatment option number 3, which is Glycopyrolate as a wipe. The brand name of this in the US is Cubrexa, and I don't think it's available in other countries, but effectively what you're doing is taking that effect of the Glycopyrolate tablet, putting it onto a wipe, and therefore you can localize it into the specific areas where you have the excessive sweating without having problems with things like a dry mouth. The issue with Cubrexa is that sometimes it's difficult to get covered under insurances and it can be really expensive. The other thing to keep in mind with Cubrexa is that a lot of people will use the wipe and then accidentally touch their eye before they've had a chance to wash their hands. This leads to your pupil dilating and you getting blurry vision. So yeah, keep that in mind. And the final treatment option I want to talk to you about is actually Botox. When excessive sweating stresses you out, you're likely to get more wrinkles, and so you take the Botox and inject. Okay, that was a joke. You actually use Botox directly to minimize the amount that you sweat. Injecting Botox in a specific area of the skin cuts off the chemical messenger to the sweat glands, which normally tells them to produce sweat. It is an incredibly effective treatment option for hyperhidrosis, and the effect tends to last for around 4 to 5 months. Because of that, people tend to come in the spring, get their Botox injections, and that means that for the summer months, they don't have to worry about that excessive sweating. Botox injections are actually seen as a medical necessity for some people's hyperhidrosis, and therefore it can actually be covered by patients' insurances. They usually require you to try and fail multiple other treatments, but you could actually end up getting Botox for free. But please don't ask me to inject any leftover Botox into your face, otherwise I might go to jail for fraud. Now, the downside of Botox injection treatments is the fact that it's an injection. This isn't usually too bad for the armpits, which is the most popular location, because we put numbing cream, we put ice there, and the injections are usually pretty well tolerated. But when it comes to excessive sweating of the palms, which is another really common location, Botox injections are really painful because because we have so many nerve endings in this part of our hands. The fact that some patients are still willing to get 30 injections into their palms is a testament to how good a treatment it actually is if you're able to tolerate that discomfort. Those are the main treatment options available for hyperhidrosis. There are a few other less commonly used treatments such as iontophoresis and mirror dry, which I might talk about in a future video, but the ones in this video are definitely the main ones we tend to use in dermatology. If you found this video useful, please consider giving it a like. Let me know if you have any questions in the comments down below, and make sure you check out the rest of the channel for other videos you might find interesting. Thank you so much for watching, and I will see you in the next one.